Welcome, everyone, to the Community Clinics as Resilience Hub's Models, Challenges, and Opportunities webinar. My name is Taylor Ward. I use she, her pronouns, and I am the Senior Manager of Communications and Education at Just Solutions. I am calling in from Yucat's Land, also known as Fresno, California. Just Solutions acknowledges that we occupy the stolen land of Turtle Island, home to countless Native tribes and nations. We recognize the ongoing struggles and violence Indigenous communities face and honor Indigenous knowledge, wisdom, and activism. We are committed to supporting justice for Indigenous communities by reflecting this conviction in our work. You can check out native-land.ca to find out whose land you're on and find more tools to support Native advocacy in your area. And for those who don't know, Just Solutions is a national organization that drives innovative, equitable solutions to the climate crisis in support of healthy, resilient communities and accountable democratic institutions. We ground our work in the broader movement for environmental justice and the guiding principle that frontline communities most harmed by climate change should lead in creating and implementing solutions. If you're joining us today, please feel free to add your name, your organization, and your location in the chat so everyone can know who else is on the call with us today. And feel free to use the chat to make connections and share information as well. And to go over today's agenda, first we're going to start with a foundational conversation led by Jennifer Moon about why resilient hubs are a model for climate justice. We'll then move into some community clinic models, learning about Crescent Care in New Orleans, Louisiana, and Suu Kyi Clinic in Los Angeles. Then we'll move into learning more about collective energy and how this can be a model for energy resilience. Then we'll have time for Q&A. So if you have any questions throughout today's presentation, please feel free to use the chat. We also have the Q&A box open, and you can put your questions in there. Now, to introduce today's speakers, we will be hearing from Reginald Vicks, Chief Operations Officer at Crescent Care. He brings more than 27 years of healthcare leadership to oversee and monitor the agency's multi-site specific programs and operations. Mr. Vicks is a registered nurse with experience in healthcare management, both for acute care and community-based settings. His professional background includes direct patient care nursing and healthcare management, along with oversight of clinical operations. We will also hear from Brittany Rivas, the Climate Adaptation and Resilience Enhancement Coordinator at Communities for a Better Environment. Brittany is proud to be involved with resilience centers and mutual aid work, recognizing the deep connection is critical for environmental justice neighborhood survival and safety. With values of collective care and love central to all that she does, she's determined to support the ongoing climate adaptation fight with Black and Brown communities to thrive and not simply survive. We will also hear from Andrew McCullough, co-founder and CEO of Collective Energy Company, a social business specializing in bringing clean and reliable power to nonprofit community health centers in the U.S. and abroad. Andrew previously served as the Vice President of Emergency Response and New Initiatives at Direct Relief, a nonprofit aid organization that provides medical resources and grant funding to people in over 100 countries and 55 U.S. states and territories. Andrew has also overseen numerous post-disaster infrastructure and energy projects around the world. And last but not least, we will also hear from Jennifer Moon, Senior Researcher at Just Solutions. Jennifer has over 20 years of experience in social services and public health, serving as a researcher, analyst, program manager, and communicator. Her experience includes serving as a public welfare policy analyst with the Washington State Department of Social and Health Services, a planning and development specialist with the City of Seattle Human Services Department, and a research associate with a Seattle-based social services consulting firm. And with that, I will pass it over to Jennifer to get us started.
Thanks, Taylor. So to get us started today, we want to run through a couple definitions or how we're thinking about this conversation today. So we'll start with what we mean when we talk about resilience hubs. So we're talking about a facility or facilities that are community trusted and community designed, that are locally accessible and open year-round, and that provide critical services necessary to health and welfare before, during, and after disaster. So things like cooling and warming centers, centers that provide food assistance, workforce development, and other community services. they ensure access to power and critical information and communication during emergencies, as well as those services. And ultimately, they increase climate resilience in frontline communities. Next slide. Okay, and so what are community health centers? So we're talking today about federally qualified health centers, FQHCs or FQHC lookalikes, and I'll explain that in a minute, that exist across the country, providing primary medical, dental, behavioral health, and pharmacy services to underserved communities. So there's a focus on whole person health. Um, the FQHCs got their start. As part of the war on poverty and the civil rights movement in the 1960s. So the community health center movement is really founded in a mission-driven approach to healthcare. It began with clinics in rural Mississippi and Massachusetts and providing care to underserved populations regardless of the ability to pay. Community health centers are nonprofit, patient-governed healthcare. Patients serve on the board of directors of community health centers, and there are about 16,000 sites across the US. Next slide. So here's a map of FQHCs across the country. And then, as I mentioned, there's also what are called FQHC lookalikes, which are very similar to FQHCs in mission and services, but they do not receive federal funding. FQHCs do receive federal funding under the Public Health Service Act. So a little bit about who community health centers serve. Um, about 10% of the US population is served by FQHC, about 32.5 million people. There's a high proportion, relatively, of rural patients. 1 in 5 rural residents are served by a community health center. About over 64% are people of color. High proportion of community health centers are uninsured, about 20%, um, and more than 60% are publicly insured. So one example of that would be the Medicaid coverage. So again, there's a focus on providing care to patients who would otherwise lack access and or may not have the ability to pay. Next slide. So why community health centers as part of the resilience hub? There's a recognition here that primary care is part of the emergency response and climate resilience infrastructure, not just hospitals. And there's community health centers, as you saw, across the country, ready and available to serve populations who are at greater risk from climate change and at greater risk during climate disasters. Primary medical, dental, and behavioral health needs do not stop for disasters, so there's a continuity of care here. Um, Community health centers also have the mission, as I said, of caring for the underserved. And the charge of community health centers not only includes providing primary care and these other services, but paying attention to the social determinants of health, things like housing and poverty and all the other food security, um, and uh, and also environmental health. So that's all within the charge of FQHCs. And FQHCs are also key community partners in many communities across the country. They work with the same populations of many community-based organizations, and so they really provide that comprehensive network of care. Next slide. And finally, community health centers as resilience hub anchors, the topic of today's conversation. So as a participant or anchor of resilience hubs, community health centers support the physical and mental health of community residents before, during, and after a climate disaster. Before a disaster, they play a key role in ensuring that people, for example, with chronic health conditions that really put them at risk, during a disaster, that those conditions are managed. So that sets a baseline for resilience right there. And then, as we'll hear, providing services during and after a climate disaster is a key role as well. They generate reliable power to support the community and keep clinic doors open while reducing clinic operating costs and greenhouse gas emissions, and they strengthen community partnerships. So with that overview, I'm going to hand it off to Reginald, who's going to talk about Crescent Care in New Orleans.
Hi, Jennifer. Thank you for that great introduction to community health centers. I'm going to share my screen. Let's see. Okay. Can everyone see that? Can you see it?
Yes, we can.
Awesome. So good morning, everyone. Again, my name is Reginald Vicks. I serve as the Chief Operations Officer for Crescent Care Community Health Centers here in New Orleans. We have two primary care locations in the city of New Orleans and that provide a variety of different services. We believe in whole person care, as Jennifer was describing, and we serve some of the most vulnerable in our community. This is just a short list of all the services that we provide. In addition to core services that most FQHCs / community health centers provide, we also offer prevention outreach services as well as a food pantry. We have pharmacy services on site. We provide some legal services to different demographics in our population as well. So I want to move right into resilience hubs and I'll give you a bit more detail about our operations as we go through this conversation. So Crescent Care is part of a program called Community Lighthouse, and we'll talk about that a little bit later. And we joined an organization called Together New Orleans, which was really ignited after Hurricane Ida sort of transformed the landscape in New Orleans. Hurricane Ida obviously came on the heels of coming out of the COVID-19 epidemic, where we had already stood up multiple innovative processes in order to reach community. Like many other organizations across the country, we stood up telehealth as quick as possible, and we transformed our service model so that we could handle the surge of clients who needed care during COVID, including COVID vaccines. So a little bit about resiliency in our area and what that looks like. When you look at different parts of the country, Louisiana is a hurricane and now tornado-prone state. When I say that, sometimes people they sort of they say, well, hurricanes and tornadoes are cyclone type weather conditions, and so they're all the same. Tornadoes were pretty much unheard of prior to the impact of significant climate change in the last few years. And so now we're seeing more and more tornadoes actually touch down in New Orleans and across Southeast Louisiana. The state of Louisiana has some of the highest frequency of power outages in the country. And the interesting fact about New Orleans and Southeast Louisiana is that the duration of our power outages is much longer than other parts of the country. Um, and so the impact of that becomes more and more significant when you consider that a lot of areas of the country have unstable power grids. So as you can see in this slide, between 2000 and 2023, Louisiana was in the top five for the frequency of major power outages. Um, in New Orleans, we started compiling some data after Hurricane Ida. Um, and Hurricane Ida was very significant for us because the hurricane did not do a whole lot of damage overall, but the length of the of time that the grid was down for a lot of people was almost 2 weeks. For our clinic, it was about 9 days total. Um, and you can see we have a significant number of individuals who are state dependent on power dependent medical devices. Um, Within our location, one of our locations that was hardest hit, there are 199 clients relying on power dependent medical devices within a half mile of our location. Due to power outages, a significant number of people died in New Orleans after Hurricane Ida, and at least 11 of them died from excessive heat or carbon monoxide poisoning, primarily from using gasoline-powered generators that, even though they were outside, the ventilation for the homes was not consistent. We had, in one of these instances where these people died, it was a whole family. So it was 5 people who died in their sleep. So why did we decide to take on the challenge of becoming a resilience hub for the community? Power outages impact access to care. Um, so we looked at our backup generator system and our emergency power system and realized that, we had no redundancy whatsoever. We were dependent on traditional diesel-powered emergency generator backup systems. And during Hurricane Ida, the supply chain failed us. And so we were not able to get diesel fuel for several days, which caused us to have to reduce the usage of our generator to keep it running. That in turn affected many things, primarily we couldn't manage temperature gradients inside the building, so many of our temperature sensitive products were impacted, and cold storage was also impacted as well. And so we lost a lot of expensive medications and vaccines and so forth. Another issue that affected us is that we had a partner who was willing to share their refrigeration system with us if we had to move product from our location to their location. But their generator failed too, and so they lost the capacity to help us. So the building that we set this initial system up at is about 65,000 square feet, and it is really essential to vital medical and support services, and keeping them accessible to our constituents in time of disaster. When we sought to optimize our generator system, we definitely included solar, which is the main component of the community lighthouse process. And obviously reduces our reliance on fossil fuels significantly and also provides clean energy and reliable renewable energy as long as we have sunshine. And solar has helped reduce our energy costs. We've calculated over time that um, we're seeing a consistent 20% savings on our energy bill from month to month. So we asked the question, why again? And it's because of service to the community and environmental stewardship. The number one reason for us installing solar panels and backup batteries is to maintain service delivery and access for vulnerable patients in our community. We also have a strategic goal to incorporate technology that reduces the impact of harmful environmental conditions, such as the release of the consumption of fossil fuels that ultimately affects the environment and greenhouse conditions. And it has certainly helped us reduce our carbon footprint and greenhouse gas emissions in our community. Healthcare organizations have been estimated to um, provide up to 17% of global carbon dioxide emissions. That number fluctuates by region. In our area, it's probably somewhere between 8 and 12% when you look at total operations of healthcare organizations. So, another reason for looking at this redundancy system and adding solar to our backup generator power is it helps us maintain our operations during extended power outages and external disasters that impact the power grid. Um, in New Orleans, we have seen a steady rise in the heat index. Actually, right now, our index is about 102 degrees. We have about 80% humidity, and the temperatures outside are hovering right around 90 degrees. And that's today. Um, so climate change environmental impacts contributed to the extreme heat impacting clients, clinic operations, and our employees' ability to be on site during Hurricane Ida and immediately following. Um, we're seeing cooling stations become the norm in our environment, as well as hydration stations. And quite frankly, some of our most vulnerable community members live in heat zones. Urban areas have a tendency to have these heat zones, especially when you have a minimal tree canopy or green canopy. Uh, a lot of people don't realize this, but New Orleans lost about 10% of its tree canopy after Hurricane Katrina. That's about 10,000 trees. And so we've been in the process since Katrina of rebuilding that canopy. In a lot of areas where there's little to no canopy, the temperature can be almost 10 degrees higher than it is in an area that has a lot of green space that can affect lowering temperatures. Community lighthouses are strategically placed. Um, the methodology is that they're in neighborhoods and it only takes about 10 minutes for someone to walk to a community lighthouse, let alone drive there. Um, the other thing that has been a game changer for us is integration with our governmental emergency management systems to create a even more robust safety net for seniors, disabled individuals, and individuals with significant health challenges to be able to access essential services. So the Community Lighthouse, Crescent Care is the only healthcare entity in New Orleans that is a fully operational community lighthouse. The the remaining community lighthouses that are online are all faith-based organizations, as you can see here, primarily churches throughout the area. Our goal is to have about 85 of these resiliency hubs statewide and about 18 in the city of New Orleans to start. So right now we're at 16, counting two to be added. So how did we become a model for resilience and disaster response through this program? It started with a vision, and we met with our leaders locally in New Orleans, and this. So we wanted to build infrastructure, expand the network of response institutions, and then we had to train people on how that integration process would work and how we would stage activating lighthouses in response to a disaster. So for Crescent Care, we had some resiliency assumptions and some operational considerations. So obviously, it's not obvious, but we did lose about $250,000 worth of products, mostly vaccines and very sensitive medications and reagents we use to care for patients. Um, our pharmacy partner, which is a contract pharmacy, Avita Pharmacy, they lost about $750,000 worth of products. And they're co-located in our facilities, as well as having some other sites. And they experience very similar conditions and outcomes that we experience due to the failure of backup generator systems. Our operational considerations is obviously to be a cooling station, we have to have air conditioning and some other support to be able to cool the environment. So our HVAC system failing was a significant component for us. And then financial sustainability. What we're not talking about today is the revenue that was lost that goes to our bottom line because we couldn't see patients and bill for services that are appropriately billable. So Jennifer spoke earlier about social determinants of health considerations. I just wanted to highlight that Crescent Care is one of the largest LGBTQIA plus service providers in this part of the state of Louisiana, let alone in New Orleans. And when we talk about the most vulnerable, but also the most impacted by all these environmental changes, it's not only the LGBTQ plus people of all demographics, but are houseless and unsheltered, and neighborhoods that are impacted by socioeconomics and also we have a lot of food deserts in New Orleans, and so we are definitely challenged with making sure that we serve the community well. So, cooling and charging stations are a priority. Access to critical pharmacy services are foundational priorities, and providing a sustainable environment to provide care and continuation of all of our wraparound services. And by that, substance use disorder services, case management, behavioral health services are core, dental services, etc. So we have embraced the fact that, as many of us have on this call and across the country, we've embraced the fact that climate change is not going away until we make a concerted effort as citizens and as a community to turn the tide on the things that contribute to it. And so we're doing our part as being good stewards and building this into our DNA as an organization. So one thing I wanted to offer here is that when you look at your hazard vulnerability analysis, which needs to be done at least yearly, we can notice that climate change is impacting where we set those priorities. Heat is becoming the number one killer of people in the United States. And that statistic is growing across the world because of climate change. So we have to change our environmental health perspective to look at how we can help manage that to keep people in care, but also to protect the health of the people that we serve in our communities. So I just wanted to close with this particular resource, the National Association of Community Health Centers, along with an organization, Capital Link, and you're going to hear about from Andrew later, Collective Energy Company, have formed what's called the Charge Partnership to work with health centers in order to help change the focus and focus in on resiliency and how that's built into how we operate. And that includes when we're doing new construction, when we're optimizing facilities and optimizing operational capacity, resilience has to be part of that conversation and developing strategies to build resilience. Solar microgrids and solar plus storage microgrids, along with other redundant, um, excuse me, systems of retaining and maintaining capacity with backup energy when grids go down is becoming part of the everyday conversation at this point. And there are a few resources that will come out when we get these slides to you. And that I'll pass it on now to Brittany.
Hey everybody, my name is Brittany Rivas, she, her, hers. I'm with CBE, as Taylor had mentioned. Just wanted to let y'all know I'm calling in from Southeast LA, the unceded Tongva lands. And just to give a little bit about CBE and who we are, so Communities for a Better Environment. Just wanted to highlight that we are nearly 50 years old as an environmental justice organization. And our mission at CBE is to build people's power in California communities of color and low-income communities to achieve environmental health and justice by preventing and reducing pollution and building green, healthy, and sustainable communities environments. And something else to note about us at CBE is that we work in 4 EJ communities across the state, so East Oakland, Richmond, Southeast LA, and Wilmington. And so that's where we'll be able to tune into. Wilmington is a neighborhood of Los Angeles. And shortly, and just one last bit about us. So we use the triad model to meet our community needs and the community-centered solutions that we need to address the environmental harms and racism that has taken place over time. So the heart of our work is truly organizing, research, and then alongside legal to support the policy and work that we carry out. A little bit about Wilmington as we dive deeper into the work around the Suchi Clinic Resilience Center. To give some context, Wilmington is surrounded by 5 refineries. It has one of the largest ports in California, so diesel truck traffic is abundant. Also have a ton of oil drilling near homes, parks, and other sensitive receptors. So for us at Suchi Clinic, for us with our partners at Suchi Clinic, we're super appreciative of the relationship that we've been able to build and hold with them because the director, Weeping Wang, has been amazing and just really open to the conversation and education that is critical for our community's survival, right? Being an environmental justice community, being able to have those conversations to share the knowledge and build up that capacity with partners is really important for the resilience centers that we connect with. So far. And so we want the space to be trusted. We want it to be comfortable for folks to access. And so that's been a really key part to maintaining a relationship is being able to continue to have community education be at the forefront of the work that we do around climate adaptation and resilience. And so in that partnership and relationship, I'm just going to set some foundation around that, we've been able to hold different workshops and things like that around building resilience. And so that could look like mutual aid efforts that we've had. So having a mutual aid community fair with partners from American Red Cross and other mutual aid orgs, giving out food and things like that, clothing and other resilience kits that we are able to offer. Alongside partnering and supporting some of the community emergency response team trainings that are available through the LA Fire Department. And as of recently, like distributing wildfire kits or mini wildfire kits at their food distributions because they have those monthly. So that has been some of the partnership that we've been able to uphold with them. But just to kind of add some additional origin stories to our relationship. In 2016, there was a community visioning session that we had with members. We originally got some funding from the Kresge Foundation in order to start our work for the climate adaptation and resilience enhancement program. And so in that process, we had these conversations with community members, and in the dialogue, folks were specifying the spaces that they felt comfortable with, that they trusted, that they frequented. And that was specific, like when it was too hot or when it was too cold, like some of these spaces that they would go to access services was Suchi Clinic. And so um, because of that emphasis on the Suchi Clinic, and because there was a relationship that members had, because they had a low income dental program that was available for a good amount of time, members felt really comfortable with the space. And so in that process, in conversations, we've tried different things out at the Suchi Clinic. One of them being in 2018, where our youth leader was able to help do like a pilot program for a cooling center, seeing how that could work and look like, recognizing that in order to truly have a resilient center be the most effective, it need to be trusted. And so being able to call out members and call out different folks that we're connected to when there was extreme heat notices, that was important. So our youth leader would call them out, let them know that we were holding the cooling center kind of pilot situation happen, and where folks could access snacks and like food and water and things like that, and just to be cool during the extreme heat days. And so that was kind of a test run. We definitely learned some lessons from that. And we got really excited when in the following year when a partner approached, right? Recognizing that um, we could benefit from having alternative energy sources for this space. And so 2019 Grid Alternatives was able to receive some funding to support installation of solar panels and battery backup storage. And so because we had that initial conversation in 2016 with members and folks were still really jazzed about the space, we let them know like the Suchi Clinic would be a great place to have this alternative energy installed. And so that took place, and ultimately the pandemic delayed the construction a little bit, with it roughly completing in 2024, and then fully able to operate their alternate system in fall 2024. I would say that the LAD Department of Water and Power did delay that process a bit, but what utility wants to lose out on some money? Not very many. But ultimately, yeah, so those were some of the timeline pieces that would be important to share about the Suchi Clinic and our relationship with them. And at the Suchi Clinic, some of the services that still remain, recently, I think in the pandemic, they lost funding for the dental program, and so they still focus in on the service that they're able to offer around acupuncture. And so the acupuncture program is still widely used by community. There's also yoga and some other community wellness type activities. And something that's really special that we've appreciated with the Suchi Clinic is that they offer monthly food distributions with anywhere from 100 to 150 households going regularly and um, accessing their very basic needs, right? Being able to sustain themselves. And so really appreciate that they offer that service, and how that's helped people continue to trust the Suchi Clinic for different services and workshops that we're able to host. And so overall, I would say uh, a little bit of lessons that we've been able to learn is just that, ultimately it would be ideal, like any location, that we would have more funding to help um, support the Suchi Clinic. Right now, it's primarily voluntary work that they're able to offer for extending hours or being able to tune in during power outages. Those are volunteer ran moments. And so ideally, you would be able to have funding for them to have paid folks to be there, not just volunteers, but from the kindness of their hearts, they open up the spaces in that way. And overall, I would say some other things is continuing to collaborate on grants and other efforts around community education is really critical. So as we are able to do so, we're able to continue to build the familiarity with the space and make sure that folks remain trusting of the site. And then just the last thing, right? Like I think that I've really appreciated about the Suchi Clinic is that they're open to making sure that like there are adaptation workshops that meet the community's needs and like, container gardening and other things are some ideas that we're trickling through and figuring out how we could support with the site. But specifically around that is like being able to be connected. I feel like there's the social cohesion aspect that is really important and like seeing that folks are connected, they trust the site, and that they're able to continue to know each other, know the neighbors, know the neighborhoods and or streets that folks are living on, makes all the difference to safety and access in the time of climate disasters that will continue to worsen, right? And so really appreciating that the Suchi Clinic makes that happen with the services that they provide and recognize that, at times our government can take time to respond and, we can quite literally care for each other and respond quicker than they do. So those are some things I wanted to uplift about the Suchi Clinic as a resilience center. It's a really cool space. I forgot to mention, and I'll pass it on in a bit. It's just that the Suchi Clinic, in a time of power outage, they have the ability to power up about 4 different spaces with the backup battery and solar combo. 4 spaces in their location. So their server, because of medical information, right? Having access to the restroom and conference room and so conference like gathering space, so to say. And then alongside the kitchen, and that being really important, recognizing that the fridge would be needed for some medication that folks and food and water that folks would need in that time. So just wanted to uplift that information, but I will pass it on to Andrew.
Thanks, Brittany. Hi, everybody. Great to be with you. I'm going to share my slides here. Okay, so I'm Andrew. We're getting tight on time, it looks like, so I'm gonna try to talk quickly, and because I have some cool things I want to show you. But I started Collective Energy after working with FQHCs, community health centers, for almost 20 years, responding to natural disasters all over the world, but in our country, really from Hurricanes Katrina to Sandy to Michael, Dorian, Irma, Harvey, wildfires in California, tornadoes in the Midwest. I would show up on site to health centers to bring medicine, and they would be closed because of this unnatural disaster that they just were hit by, or were just in the same grid as where the disaster hit, so they lost power. And so I kept seeing time and again the impact of power loss on health centers, and was struck in Hurricane Maria. I was in Puerto Rico for quite some time, delivering insulin around the island in cooler boxes for 3 months. Puerto Rico has the highest rate of diabetes in the developed world, longest power outage in U.S. history, led to a huge loss of life. And it wasn't the hurricane itself, just like Hurricane Katrina. It wasn't the hurricane itself. It was the aftermath of power loss and that impact on people. So we started a company to address this issue with the basis of the problem, as Reginald has already described, is you can't provide quality health care without power. Health centers now are required to have electronic health records, store vaccines and refrigeration. None of that works. All the things they have in place to see patients goes away when the power goes out. And yet the power is going out more frequently. We know that it's going out more often, affecting more people, lasting longer. And then critically, we know power outages don't affect everyone equally. So the patients that community health centers serve are the most vulnerable. They rank the highest on risk index. If you don't have a car, if you don't have a way to, get the lucky those lucky ones amongst us, when we lose power, we have a car, hop in it, there's gas in it, there's money for a hotel room. That's not the case, obviously, for many, many people. They need somewhere to go. They need somewhere close by where they can go. And so we build microgrids specifically for community health centers, but we build microgrids for any community serving organization where their community would be impacted if they were closed, and specifically those that have a requirement for power, like a health facility. We've done food banks. They need to keep their refrigerated and frozen foods cold. And we talked to them all about becoming resilience hubs. So our model is to partner. So we partner with Feeding America for food banks. We partner with the National Association of Community Health Centers. We educate health centers and food banks about this issue, about becoming a resilience hub, what they need to do. We design and build and finance then the solar plus battery systems for them. This is the partnership Reg already talked about. Reginald is on our advisory board, by the way, so it's nice to be on the same talk here. The Charge Partnership, where any health center can go to access information about this and then come to us for a bespoke design. We also have a lot of partnerships with foundations that have provided both grant funding and what they call program-related investments for us to build these projects for community serving facilities at the lowest cost possible. So we have funding, someone mentioned Kresge, we have funding from Kresge and the Packard Foundation, the Schmidt Foundation of what they call a program-related investment. So we have 2% interest money to build as many microgrids for community health centers as we can to make it as low cost as possible to health centers. This is a video that I was going to show, but I think in the interest of time, it'll be in the deck. It's a short video, but it's outlining the benefits of a microgrid. And what we're trying to show, and what we often have to talk about with folks, is how I think like solar energy has been sold in the wrong way in our country for since solar energy became a thing. It's always sort of sold in terms of, is it going to save you money? And what we're trying to show, and I'm going to demo something else here in a second, it's much bigger than that. It's not just about saving money. It's about what happens to a community or to patients, people in a community when their community serving entity or when their building that they would go to can't see them anymore. So there's a lot of other aspects about doing this that's more than about saving money. Interestingly, there's been survey data that shows that health center staff feel better working at a health center that's powered by the sun, that's doing something positive for climate change. They feel better about going to work, and staff retention and recruitment is a major issue. And so a little thing like that, I get texts from medical providers when they go to their clinic and they plug in their EV car to the EV charger that we installed at the health center when we installed the solar microgrid. So there's these ancillary benefits. I'm going to show this live map in a second, so I'm going to skip through it. And sorry, I know I'm talking really fast here. There was a question about rural locations, rural areas in the questions that came in advance. So I just wanted to mention we were awarded with NAC a $70 million award from the Department of Energy to build 125 to 175 microgrids for rural community health centers in Region 4 and the Southeast, 8 states in the Southeast. So it'll create sort of resilience hubs at rural health centers all across these 8 states over the next 7 years, where power is the least reliable and where the patients would have to travel the farthest distances to get to another healthcare facility. So that's why we sort of picked that region. We have a number of case studies about some of the projects we've built and how they are now also resilience hub. Chiricahua is in southern Arizona, right on the border in Cochise County. They lose power. They estimate 30 times a year from monsoon rains and have to shut down. So we're building 5 projects for their sites in Cochise County and a couple of other videos. And then this is just a current look at all the projects we're working on. It's across 38 states. And again, we want to show not obviously the carbon offsets annually that these systems are producing, but also that this battery capacity is what's keeping these clinics open. So there's, thousands and thousands of hours of backup power in these sites. I'm going to show one other thing real quick, and then I'm going to hand it over because I know we're getting at time. I'm going to show two quick things actually. So this is a dashboard we built that shows every single community health center building across the country, 12,419 sites. You can sort them by state, county, region. You can sort them by if they're in a low income community, and you can see 8,405 of them are. We can sort them if they're in disadvantaged communities, rural communities. Each one is an interactive button, so we can see how many patients they serve, their demographic population, where they are. But what I wanted to point out is the red indicates how many areas of our country are currently right now without power. So the counties in dark red are where power outages are occurring. There's actually a power outage in my house right now. I'm being powered with my solar battery microgrid on my house, literally right now. I just got an alert from my battery. So we can see here that we're estimating in the last hour, 1,247 FQHCs have been without power across the country. And this, I look at this all the time. It changes where it happens. As Reginald said, Louisiana is usually the worst. And then I want to show one other thing, which is I'm very excited about it because it's being tested right now, so it's not ready for prime time. But I'm going to demo it here. We just had a group of 5 master students work on this project for us for a year. And it is another tool that, as I was trying to explain earlier, to show community serving facilities, in this case, it's health centers, more than just a cost benefit, but the community benefit of building a microgrid. So I'm going to pick on a site here. These are all the FQHCs in the country. And what this is going to show is the financial, but also the social vulnerability. So this site ranks 49th percentile for community health vulnerability, 74th percentile in FEMA disaster risk index. They can adjust their building square footage and utility rate, and that'll change sort of the ROI on the installing a microgrid. They can adjust how much dollar of vaccines they keep in the medicine, in their refrigeration, how many patients they see in an hour. So they know if you lose power and you see 20 patients an hour, what does that mean to both your financial bottom line, but to your patients? We also show here the frequency of power outages that occur in this county year over year. So of course they're going up. And then the duration of outages between 15, 30 minutes, 30 to 45, all the way up to over 4 hours. And then again, the social vulnerabilities. So how important is it in this community that this facility stays open? So this is a very short demo of this. We are going to launch this live here soon. And really, again, try to paint a more holistic picture than how it's typically done of am I going to save money by installing solar? It's not about that. It's about ensuring continuity of care for your community. And I will stop there.
Thank you so much, Andrew, and thank you to all of our presenters. That was amazing. I feel like I learned so much. I'm really excited to keep hearing about the work you're doing. I did want to get a few questions in before we wrap up. Andrew, there were a few questions about whether or not those tools you shared can be shared out, and if we can share the links with those.
Yep, I can share that.
Perfect. And then we will follow up with the resources in the follow-up email. But yeah, just before we wrap up, presenters, was there anything else you wanted to share before we end the call today? Yes, I will be sharing the recording with everyone who registered. Amazing. Great. Well, before you
I
all,
would, sorry,
go ahead.
sorry. There's a question about financial pathways. We do we do try to take the financial barriers off the table. So we have partnerships with CDFI lenders who can make loans to these health centers for clean energy projects, and we also can fund them ourselves for no cost to the site through what's typically called a power purchase agreement. So the site doesn't pay anything. Instead, they pay it back through bill savings over time. So money is always a barrier, but we're really trying to make it the tools available so it doesn't have to be.
Great. Thank you for sharing that, Andrew. Amazing. I just dropped the post-event survey for today's event in the chat. If you could fill that out, let us know what you thought about today's event, what other resources might be helpful for you as you're thinking about these issues, and what other events might be helpful to help you plan. And again, thank you to our presenters for doing such an amazing job of sharing really great work. And we look forward to continuing this conversation with you all. And I hope everyone has a wonderful rest of your week. Thank you.